Thank you so much for tuning in. I'm Karina, and I'm joined today by Dr. Colin Ross. He is an author and psychiatrist out of Dallas, Texas. In our last video, we were talking about biological psychiatry and specifically how your personal journey through wanting to become a psychiatrist and then entering the field and then realizing that, wait a second, the scientific evidence is actually showing that there aren't biological disorders or there aren't biological brain diseases. So can you kind of fill us in on what is the paradigm today? Like, where do we stand today in terms of the psychiatric model?
Well, the paradigm that dominates psychiatry today is called biological psychiatry, and it's basically there's internal biological problems arising from a whole bunch of genes that are causing abnormalities in your brain, chemical imbalances, that are then causing abnormal behavior and symptoms. And the environment has a little minor role to play, maybe in triggering or shaping some of the symptoms. So if you have the brain disease of schizophrenia and you're living in America and you're paranoid, you might think the CIA is after you. But if you're living somewhere in the depths of the jungle in Africa, you never heard of the CIA, so you'll have a different delusion. And that's about all the environment is allowed to do in mainstream biological psychiatry. The evidence clearly proves that that's not scientifically correct. And so the alternate paradigm that I subscribe to is actually one of my books is called The Trauma Model. And the trauma model basically says that psychiatry is kind of like the rest of medicine in a way. If you go to internal medicine, pediatrics, family physician's office, very, very tiny percentage of people have a defined specific genetic abnormality. Now, if you do have cystic fibrosis, you need a specialty clinic. We need to understand the genetics of it, and there's going to end up being some kind of biological cure someday. But 95+% of the work of internists, family physicians, pediatricians is people who have no defined genetic abnormality. We're not even thinking about doing genetic testing on them. They're either a little taller, a little shorter. They can run a little faster, not quite as fast. They have a little bit better diet, a worse diet. They're a little more hardy, a little less hardy, all within a range of normal. And something's come in from the environment to hurt them. Now, it could be a bullet, could be a car, could be a tree they hit when they were skiing, could be a virus or bacteria, cigarette smoke, too much fatty food. So almost all of the day in and day out work of regular physicians is dealing with more or less genetically normal people who've been affected by stuff from the environment. That's just the reality of medicine. And there's a very small number of people who have a defined genetic problem. And I think in the mental health field it's the same thing. Instead of looking for all these specific clusters of genes that are causing these DSM disorders as if they're separate diseases, reality is that we have more or less normal people. Some are a little more resistant, some are a little more susceptible, and they get blows from the environment that throw them out of balance. But instead of being out of balance in your blood or in your liver or in your actual physical brain, you're out of balance behavior, feelings, thoughts, psychology, social function. So what we're seeing is an understandable reaction to trauma from the environment, but it's basically psychological, social, emotional trauma. And then that doesn't mean that medications are totally useless necessary, but it makes the role of medications more humble. Right. They may, dampen down symptoms a little bit for a while, but basically the treatments are going to be psychological, social, so group psychotherapy, individual psychotherapy, housing issues have to be taken into account, right. Crime in the neighborhood, and then we've got to start looking at your overall body, mind, soul, spirit health. So we've got to obviously look at diet. We've got to look at what's pretty obvious in America, which is we've got problem with weight, problem with cholesterol, problem with diet, problem with pesticides, problem with pollutants. And then we're just shifting off of this internal biological abnormality to a model where it's a more or less normal person who's a little more susceptible, a little less susceptible to a whole variety of insults from the environment. They're causing a whole variety of different symptoms and problems. That's the basic model. And now that model I've set up in great detail to be scientifically testable. So it's not just kind of a soundbite war. This is a model that can be investigated, tested, looked into scientifically.
Right. So that's definitely interesting to think about the differentiation or the distinction between, where psychiatry is coming saying these are biological, biochemical problems with the brain, and you're actually saying, no, these are mainly due to environmental factors, and the role of anything genetic or biological is actually much smaller than what's probably being
right assumed. Until that's true, except then when you kind of come around the loop, if you take crystal meth like every day for 3 years, it's going to damage your brain and you're going to have a biological problem. Mm-hmm. So when you're deep, in the trenches of some severe mental disorder, you can definitely damage your brain and have a brain disease, but that's not what caused you to start the substance abuse. Right. And the same thing with if you have whatever it might be. Let's just say pesticides are causing ADHD, for instance, which I don't know for a fact. But if pesticides are causing ADHD, then they could damage your brain, and you could have the symptoms of ADHD as a result. Right. But there's nothing basically genetically abnormal with you to start, except you had more exposure and you were a little bit more susceptible than the next person. Right. But that's not a gene or a set of genes for ADHD. Right. It's a very different model.
So can you go into a little bit more detail about what specific traumas could cause, let's say, depression as an example?
Sure. Well, first thing is that depression's got numerous different causes, one of which can be cancer. Having depression as a side effect of cancer, a viral infection. So there can be physical causes, but that's different from a genetic disease of depression as such. So I commonly interview people, because I do groups in my trauma program all the time, and they'll give me a history of depression, so they're clearly profoundly depressed, way beyond just normal sadness. It's really interfering with their function. They're actively suicidal. They need some kind of help. And then they'll tell me it just kind of came out of nowhere for no reason. And so if I was a regular biological psychiatrist, I'd go, oh, well, that's because it's a disease. It's nothing to do with your personality or your parenting, and you can't help it, and here's this medication. But what I always find over and over and over is, okay, let me just ask a few more questions here. And it'll turn out, oh, okay, so wait a minute. Your mother died 3 years ago, and you had a very conflicted, complicated relationship with her, and she knew that the sexual abuse by your dad was going on before age 10. She didn't do anything about it until dad left when you were 12 because he had a new girlfriend. And so you had a lot of resentment at mom, but you also loved her because she was your mom, and she was the only parent who stuck around. But then she had the 2 abusive stepdads who came into the picture. And not only that, something happened in your first marriage. Mm-hmm. You were beat up by your first husband, and your kids are angry at you because you're not letting them see their dad enough. So I end up with a whole set of things that have happened in the person's life just recently that could trigger the depression. But the trigger is taking us down into this underground ocean of relentless messages from the parents of, you're not lovable, you're not worthy, you're not worth protecting, you're nobody, you're nothing, you're an object for use, abuse, and disposal. And so this negative beliefs about the self and the worthlessness of the self have been ingrained in year after year after year after year. Mm-hmm. So if you're walking around saying to yourself, I'm useless, I'm nobody, I deserve to be abused and neglected, and then people do abuse and neglect you, and then the people who've done that die, is so not rocket science. It's so easy to see how this would lead any normal person to feel lousy about themselves, feel that they're useless, have a depressed mood, think they have nothing to contribute, and think the world would be better off without them. And so that's kind of basically what I see over and over and over and over and over. It's an understandable reaction of a person. My motto is, there but for the grace of God go I. And then what I do is, instead of telling the person they're genetically abnormal, they're not like one of us, their brain isn't working right, their chemicals are out of balance, but here, take this pill and you'll be okay. Instead, I tell them, this looks to me like a normal, understandable reaction to depression. These are incorrect beliefs you have about yourself. They're not actually true. It's understandable why you have those beliefs. Let's re-examine them and start working the person out of it. Mm-hmm. And so that's one part of what I would do.
Right. So it's really interesting that you make such a clear distinction between, an underlying genetic or biological dysfunction that a person could be born with, as opposed to looking at, like you said, physical, biological things that could happen to the person. They're infected by a virus, or they have some other disease that affects them externally. And then the environmental factors coming in there too. But, everyone is really under the assumption that you're either born with a mental disorder or you're not, that this is something genetic, this is a dysfunction with your brain. And it's really quite revolutionary to say, well, actually, no, there's nothing wrong with you. You're having a normal reaction to environmental factors.
And to me, that is the most profound destigmatization you could possibly have.
Right.
That you're not a, quote, mental case. You're just a person who's been kicked around by life, and you're having an understandable reaction.
And ultimately, I think that gives the person, 1,000 times greater hope than a mental health diagnosis, which is saying, yes, like as you were saying, yes, there's nothing you can do about this. You were born this way. There's no hope for you. There's no cure. You're going to be on this treatment the rest of your life. And what do people say when they don't want to take their psych drugs? There's nothing wrong with me. And it really is, because psychiatry is coming in and saying, oh, I know there is something wrong with you, but without any science to back it up.
That's a good summary of the situation.
Wow, that really is incredible. Can you tell us where we could find out more information about you or works that you've published?
Sure. The easiest thing is just to go to my website. And in terms of the trauma model, the two main books are the trauma model, which is kind of half the science, the logic of it, and how my therapy model works. And then trauma model therapy, which is very readable for anybody, explaining not so much the science side, more the how-to and the nuts and bolts of how the therapy works.
Mm-hmm. Very interesting. Well, thank you so much for joining me today, and thank you for tuning in.